of abnormality today, looking at psychopathology for your revision, for your test. So what is abnormality? What are the 4 definitions of abnormality? So we need to be thinking of abnormality as something that affects the minority. It's rare, it's atypical, it's unusual. And there are these 4 definitions that you need to remember. So statistical infrequency or statistical deviation, you can call them either. And this is where you are thinking of statistics. Graphs is deviating from the statistics. We've got deviation from social norms. So here we have got the fish swimming against the school, against the pack, going against what's normal. And then we've got the failure to function adequately. A picture here of I think it might be Ian Beale from Coronation and from EastEnders, sorry, when he unfortunately had lots of things happen in his life that meant that he had a breakdown and was unable to function adequately. And the last definition is deviation from ideal mental health. So as much as we would all like to look like this lady here, basking in the glory of ideal mental health, actually one of the definitions of abnormality is deviation from ideal mental health. So we'll look at all 4 of those in a bit more depth, and we'll evaluate each one as we go along as well. Okay, so statistical deviation, or statistical, it can be called statistical infrequency. Statistical deviation is what I'll call it in this video. So a statistical deviation is when a person's trait, thinking, or behaviour is classified as abnormal if it's rare or statistically unusual. So we have to be really clear about how rare a trait or behaviour needs to be before we class it as abnormal. So we can see here we've got the normal distribution curve for IQ. So you can see that the vast majority of people will fall in this part for what their IQ score was. And then these outlying parts, the ones that are the lowest 2.2% of the population, or 2.3%, and the highest 2.3%, these are our very, very rare outliers. So this occurs when an individual has a less common characteristic, so being more depressed or less intelligent than the general population. And really, in every human characteristics, the majority of people's scores are going to cluster around the average. We're all going to be kind of fairly similar, and some will be slightly above, some will be slightly below. And that is the normal distribution. But then what we have are the very, very ends of either scale, which don't fall in with the normal distribution. So this is the example of the intellectual disability disorder. So the average IQ is set at 100. And as you can see from here, most people, well, 68% of people have got the range of the IQ from 85 to 115. That's kind of our big chunk of people here in this section here, so plus or minus 15 basically of the average. Only 2% here have got a score or of an average below 70 for the IQ test, and they are likely, these people that fall into this category here are likely to receive a diagnosis of a psychological disorder. In this case, it's the intellectual disability disorder that they would receive a diagnosis of. So now that we understand what statistical deviation is, and really as soon as you hear statistical deviation, you need to be thinking about your bell curve, and you need to be thinking about those either end of it. Here are some evaluation points. So first of all, in terms of real life application, it has a really useful real life application because it's very clear what normal and abnormal behaviours are, and we can really clearly see what the norm is and what the outlying abnormality is. So using statistical deviation, you can also work out how severe symptoms are during a clinical assessment. So if you can make a really good judgment and assessment using data and using statistical information, you can really see how far from the norm that person is in whichever trait that you're looking for. Something that is another evaluation point is that unusual characteristics can also be positive. So as much as we saw that 2% fell below the 70, we also saw that 2% fell above the 130. So we're outside of the normal range, we're abnormal, but that doesn't mean that it's going to need treatment. These people that have got IQ scores of over 130 is a really positive thing, and is not something they're going to need a diagnosis of any kind of disability or disorder. So there is a limitation to the concept of statistical deviation, and it means that it's really important that statistical deviation should never be used in isolation to make a diagnosis of abnormality. It's a tool in the armory, but not a thing to be used on its own. And the other thing for the evaluation of the statistical deviation is that not everyone benefits from a label. So someone might be very happy, living a happy life, doing whatever he or she is going about doing, and suddenly they'll to then get a label of intellectual disability disorder is not actually something that's going to make them happy. It might even have the opposite effect. It might have a negative effect on how they view themselves or how others view them, and make them feel distressed. So the label is not something that is always a positive thing. Okay, next definition of abnormality is deviation from social norms. So that was our fish swimming against the rest of his friends, going against what the norm was. Another example here is this chap with a very tattooed face, which obviously is going against the social norms that we have. And we tend to notice people whose behaviour is a deviation from social norms. So when a person behaves in a way that's different from how we expect them to behave. So we have these unwritten rules that and sometimes laws as well, written rules, that dictate to us how we should behave. And there are certain things that we expect somebody to do in society in order to fit in with everyone else. But there's something to remember about social norms, and that is that they are specific to the culture and the time that we live in. It's really important to remember this, because some things that we consider to be completely normal in our culture is considered abnormal in another culture, and vice versa. There's a couple of examples that I've given you here. So in some countries in Africa and Asia, the practice of neck lengthening was something that was considered beautiful, and something that was quite a cultural thing that some ladies did. Whereas in our culture, that's not something that we would consider normal if somebody was trying to lengthen their neck. Or for example, in China, the street food that people might eat. Example here of some scorpions on some sticks. If people ate that in our culture, we'd be thinking they were very strange. Whereas in China, that might be something that's completely normal. So the culture is really important in terms of thinking about these deviations from social norms. The other thing that is important to remember is that with time, social norms change as well. So we've got here a picture of a couple getting married, same-sex couple getting married, and for us now, in the time that we live in now, in our culture, this is quite normal for us. This is something that is not going against social norms. Whereas 50 years ago, this would have been a huge deal, and in fact wouldn't even have been allowed. It wasn't possible for same-sex couples to get married. And in fact, going back a little bit further, there was a time in this country when homosexuality wasn't allowed at all and was considered to be a mental disorder. So times change, and social norms change with that time. And there are still countries in this world where homosexuality is not allowed. So sometimes the time it takes for social norms to change depends on where you are in the world as well. And another example of how times change is this picture of the Ku Klux Klan here, that when this was happening, it was at the time not something that was particularly shocking, whereas now, with time, we realise that this was an extremely shocking thing to be happening. We find it very, very shocking, because in our time now, treating people of colour in a way in which the Ku Klux Klan did is absolutely abhorrent, and we find that a very difficult thing to understand, that there was ever a time when that was considered okay. So an example of deviation from social norms is the antisocial personality disorder. So a person with antisocial personality disorder, or psychopathy, is impulsive, aggressive, and irresponsible, according to the DSM-5. And one of the things that the DSM-5 states is that antisocial personality disorder is an absence of pro-social internal standards associated with failure to conform to lawful or culturally normative ethical behaviour. So they lack any kind of understanding and feeling like they want to hold themselves up to those social standards that exist within society, and they fail to behave in a way that is normal in society. So and they don't have those same moral standards. Psychopathic behaviour would be considered abnormal in a very wide range of cultures. So the evaluation of the deviation from social norms, it cannot be the only explanation of abnormality. It shouldn't ever be the only reason for defining it. We have to also consider other factors such as distress to other people, resulting from, for example, antisocial personality disorder. So if somebody's doing something that's going against social norms, if it's not hurting anybody, including themselves, then perhaps that's okay. But we have to take into account, is this behaviour causing distress to other people, and thereby we can say it's abnormal. Another evaluation point is the cultural relativism, as we talked about the cultural and time-specific part to social norms and deviation from social norms, about how they vary from one generation to the next. And a person from one culture labelling someone from another culture as abnormal, or behaving abnormally according to their standards, isn't helpful. So in some cultures, as an example here, and in some cultures it's normal to be socially acceptable. It's normal to be hearing voices. So for example, a shaman maybe in somewhere in an African country is something that their village might absolutely welcome and hope that he would be hearing voices and helping them, guide them. But in this country, this would be something that it wouldn't be accepted. So it could create problems from people from one culture living within another cultural group as well. And another evaluation point for the deviation from social norms is that it can lead to human rights abuses. So too much reliance on deviation from social norms to understand abnormality can lead to systematic abuse of human rights. And this is some examples of it. That these two examples are showing that the diagnoses that came about as deviation from social norms at the time, they were actually there to control, in these examples, minority ethnic groups and women. So they came up with a diagnosis of drapetomania, which black slaves could suffer from, and the symptom of this diagnosis was running away. And if they said, well, this person is obviously, this black slave is obviously suffering from deviation from social norms, because all of the others are all working away and not trying to run away, and this one's running off all the time, he's obviously got something wrong with him. He's obviously suffering from a mental disorder, because he's running away, he's not doing what the others are doing. And actually what this was just controlling them. And same again, another example was nymphomania, people saying that women that were sexually attracted to working class men had nymphomania. And actually what they were just trying to do was make sure that those women didn't do that. They said, gosh, you are behaving against the social norms, therefore you've got something wrong with you, you've got a mental disorder, and we will make sure that that gets treated. And actually, again, it was just a way of control. Okay, next definition: failure to function adequately. So a person may cross the line between normal and abnormal at the point when they can no longer cope with the demands of everyday life and they fail to function adequately. So I've got a few pictures to help you try and remember this. So it's the key sort of parts of the failure to function adequately are to do with being unable to maintain basic standards of nutrition and hygiene. This little pug staying in bed all day, not wanting to move, not being able to hold down a job. Hold a job. It's a bit strange on that one. Hold down a job, or maintain relationships with people around them. So I've got a picture here of a young lady who's obviously isolated there. So the failure to function in society and look after yourself, feed yourself well, keep yourself clean, being able to go to a job, being able to have relationships with people around you. And if you don't have that, then you are failing to function adequately, and therefore you could be diagnosed as having abnormal behaviour. So Rosenhan and Seligman said there are some signs that can be used to determine whether somebody is not coping, whether somebody is not functioning adequately. And some of the things that Rosenhan and Seligman said was when a person no longer conforms to standard interpersonal rules. So they're not able to have eye contact, and they're not understanding about respecting personal space anymore. So they forget about the interpersonal rules. When a person experiences severe personal distress, this is a sign of failure to function adequately as well. And also when a person's behaviour becomes irrational or dangerous. Again, another sign, says Rosenhan Seligman, that somebody is failing to function adequately. One example of how it can be used is in combination with the statistical deviation, and we can use the statistical deviation with the evidence of failing to function adequately in order to give us a better chance of giving us a good diagnosis that's going to be an accurate diagnosis. Okay, so evaluation of it. It takes into account the patient's perspective. It's subjective, not very scientific, and it takes away individuality. For example, dangerous jobs, we look at each one in turn. So it recognises the patient's perspective. It's important that the individual can have a chance to be able to give their own subjective experience of how they're feeling and what's happening with them. But it is difficult to assess distress because it is subjective, and somebody feeling distressed, one person feeling distressed might be very different from the other person's sort of threshold and what they feel is distress. But it does acknowledge the experience from the patient's point of view, which is really important, as it is another method to help us assess abnormality. So that's an important part of it. It recognises that patient's perspective. Another evaluation point is is failure to function adequately not just deviation from social norms? So, for example, New Age travellers, they don't live in permanent accommodation, may not work. Does that fit in with our failure to function adequately? Well, maybe it does, but surely that's just, they're just not behaving in a norm, so a societal norm way. And does that then mean that they're failing to function adequately? No, maybe they've just chosen a different lifestyle for themselves. Base jumpers take part in extreme sport with high mortality rates. And one of the things that Rosenhan Seligman said was that a person's behaviour becomes irrational or dangerous. Well, somebody taking part in an extreme sport, you may say that they are irrational, dangerous. I don't know if you've seen the wingsuits, the people that jump off the top of a mountain just with a wingsuit and fly down it, which is extremely dangerous. Does that then mean that they are behaving abnormally and failing to function adequately because they are putting themselves at danger? Or have they just decided to enjoy that adrenaline rush and want to take part in that extreme sport? And spiritualists taking part in religious rituals, believing they're communicating with the dead. Again, are they just deviating from what we think is normal? Or are they failing to function adequately because they are believing in these very, very strange things? If we treat these behaviours as failures of adequate functioning, then we may be taking away or limiting people's freedom of choice. So we need to be careful with saying, actually, you're not functioning adequately because you've chosen to do something which isn't quite the norm. And then subjective judgments. When deciding if someone's failing to function, someone must decide whether the individual is distressed. We talked about this a little bit already. Some patients say they're distressed but do not appear to be suffering, or vice versa, the other way around. So prostitution, a prostitute might say, no, I'm not depressed, I'm not distressed, but actually they may well be. A psychiatrist, however, does have a right to make the judgment, and they use a diagnostic tool to help them. So they can use a checklist like the Global Assessment of Functioning Scale. So here's an example of it. And a psychiatrist might talk to a person and decide where they are on that global assessment of functioning. So you may score very highly and have superior functioning in a wide range of activities. Life's problems never seem to get out of hand, sought out by others because of his or her many positive qualities, no symptoms. That's the very highest level on that scale. And then going right down to kind of developing more and more symptoms until we get down to the 10 to 1, persistent danger of severely hurting self or others, recurrent violence, or persistent inability to maintain minimal personal hygiene, or serious suicidal act with clear expectation of death. So a real wide range of functioning there, and they can use that scale to help them make a decision to try and make it a little bit less subjective. Last but not least is the deviation from ideal mental health. This is our final definition, and this approach ignores the issue of what makes someone abnormal, but instead it looks at what makes somebody just normal, just a normal man or woman on the street, quite happy with their mental health. So Yehuda, I thought little baby Yoda might help you remember her name. Ideal mental health you have. She came up with some ideas of what ideal mental health looks like. So no symptoms, no distress, rational, we perceive ourselves accurately, we reach our full potential, self-actualize, we can cope with stress, we have a realistic view of the world, we have good self-esteem, we are independent, and we successfully work, love, and enjoy our leisure. Well, that is pretty wonderful. Imagine if everybody was like that all of the time. That potentially leads us on to an evaluation point in a minute. So It's a useful definition, this one, because it's a comprehensive definition. It covers a broad criteria, and without these, it does cover most of the reasons for someone seeking help. So it's a useful tool to help you think about mental health and to help you look at where there are areas to work on and to 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 improve. Um, Another evaluation of it is cultural relativism. So some of Yehuda's classifications are specific to Western European and North American cultures. So, for example, in our Western society, we see independence as a good thing. It's on our list of ideal mental health. But actually, some cultures see independence as a bad thing, and it's a selfish thing, and you're not working as a team and as a collectivist society. Self-actualization is an example of a selfish act. All you're bothered about is achieving the best you can be. What about everyone around you? In some cultures, that's the feeling. So there is a problem with Yehuda's list in that it doesn't work for every different type of culture. And then this last one was kind of what I alluded to a minute ago, that it sets this unrealistically high standard for mental health. Because really, it's very true, very few of us meet all of Yehuda's criteria all of the time. Therefore, this approach would see most of us as abnormal. But on the positive side, it does make it clear to people the ways that they could benefit from seeking help and treatment to improve their mental health. So it does have clear and practical, useful applications, but it's something that we need to be a little bit careful with, thinking that this is the standard for mental health, to have all of these things in this list all of the time, because I think it's unrealistic. And that is everything for the definitions of abnormality. I hope that has helped you to revise, and hopefully that has just made things a little bit clearer in your heads.